I'd like to talk about a 25-year-old female that came to see me in December of 2020. She has multiple symptoms across multiple systems, and this is quite a laundry list. She's 25 and comes into me and says, in November of 2020, I had a flare-up with extreme fatigue, bloating, puffiness of her face, brain fog, concentration problems, hemorrhoids, GI trouble, swelling of joints, body aches and pains, and stomach pains. Her primary care said, let's watch and wait, but her symptoms worsened. 2 weeks later, she's in the ER. She gets a CBC, which was normal. COVID was negative. We're now in the COVID time, so COVID is negative. She saw her PCP and endocrinologist. This is all before she saw me. She had a thyroid panel. She was told that all tests were normal, Lyme negative. Her CRP and ANA tests were normal. The endocrinologist said the symptoms were not due to thyroid issues and there was nothing else that they could do. Now, a couple other things. Prozac for her was started in March of 2020. She also was taking Accutane for 4.5 months prior to this flare-up, but it was suggested, not by me, that she stop that. So a few weeks prior to coming into my office, she had stopped that. She was already gluten-free at age 25 and mostly dairy-free, more on that in a moment, for about a year. Depression was getting worse with all of these symptoms as well. Previous diagnosis of Hashimoto's hypothyroid, which she was under treatment for. General anxiety and depression. Whew. At age 25. In she comes to see me. 1 month later, January 26th of 2021, after 10 visits to my office, she says, I am 70% better. That's pretty cool. I like my job. I like my job. Her gut, digestive, fatigue, and joint pain symptoms, her muscle aches, brain fog are all improving. Here's her quote. The progress I've seen in just a couple of weeks has been incredible. I'm able to think, do, and live so much better. That was 1 month of care, 10 visits in my office. What did you do, Dr. Fuller? I did a couple of simple things. I did my little chiropractic care stuff. I put her on some antimicrobial supplements. We did some stuff like omega-3 fish oil. We did some vitamin C stuff. We had her on vitamin D. We did some B complex. I think we did some magnesium, and we might have done some, that's right, we did some urinary tract infection supplements. Even though she had no symptoms, it was indicated on a urinalysis that there was some stuff going on. So I put her on D-Mannose and Uva-ursi. You can look that stuff up. So I put her on that. And I said, you know, let's tighten it up on the no dairy thing. Okay. So here we are. We did 3 little things, and she's 70% better in one month. Imagine now, and I'm imagining this, and she's imagining this, imagine what she can do with this laundry list of symptoms if we stay on this track, see what happens for the rest of her life. That's why I show up in my office. Try a chiropractor, see if it might help you. There's nothing to lose but some of these symptoms that a lot of people are having. I'm Dr. Scott Fuller.